So during our training course, we taught the physicians using hands-on techniques. They had the opportunity to work with real patients, isolate the fat tissue doing a mini-lipoaspirate procedure. They also have the opportunity to learn how to separate the stem cells from that fat tissue. The nice thing about our courses is that they're very small. There are 8 to 10 doctors only, so it's all hands-on. They have the chance to work on specific patients, actually manning the cannulas and then working under the hood to learn how to do the stem cell techniques. They also have the opportunity to learn how to do adipose as well as bone marrow and also platelet-rich plasma. Being able to do platelet-rich plasma and learn some of the different methods of separating the blood, so you can learn how to do either higher platelets with higher white counts or lower platelets with lower white counts, and then how to apply that to the different indications. So it turns out that fat tissue is one of the most plentiful sources of stem cells in the body. We can actually get 500 times more stem cells from fat than what we can get from bone marrow. This is great news because most patients have enough fat that we can collect that very easily and then isolate those stem cells in a very simple procedure. It takes us only about 35 to 45 minutes to collect those stem cells, and then we can immediately deliver them back to that same patient and they can begin to enjoy the benefits of those stem cell treatments.
We've got an innate ability in our own bodies to treat ourselves. This just ups the ante and supercharges us. It empowers our own body that may be just lacking or failing, and it just gives that ability for us to be able to treat ourselves in a very natural way, not using drugs or surgery or anything, using ourselves to heal these problems. And this technique that we've seen this weekend gives us that ability to supercharge us and be able to treat these conditions that traditionally we've been failing at.
Before, I've come across a lot of companies that have come down to us to promote stem cell therapy, but they haven't been able to back it up with a proper training. And this is the difference we're getting here.
I've done platelet-rich plasma for quite some time and got some nice results, but this is going to take it to a whole new level. It's going to be really regenerative medicine, which is what we're not, instead of just maintenance and tweaking a little bit, this is going to be really regenerative. So I think it's the way of the future, most definitely.
It was easy, much easier than I thought. That we will be able to retrieve the stem cells and work with it. When you talk about stem cells, it always is like bone marrow aspiration, and it's a bit more involved. But using fat cells and liposuction was quite easy, and that was fascinating that I can do it.
Dean's done a great job. It's very well organised, very smooth. Dean's got that experience in the scientific background, and he's brought that to the training, and I got the feeling that all the participants have got a lot out of it.
I'd recommend this course to anyone who wants to get into stem cell therapy. It would be a very good start.